mean, not to, just to redirect it a little bit, is there, I mean, I know there's the biennial symposium that happens internationally. Is there any discussion within that forum or among you in the US about credentialing and training programs and sort of how to institute that? And would that help any with some of the roadblocks that are out there? Because some of the questions involved large, very well-respected cancer centers in the US who explicitly don't buy into this as the solution for patients. So with the credentialing, is the credentialing something that you guys talk about or think about, and would that in some way maybe help bridge the problem with sort of the mixed message out there? Because people go to some of these cancer centers and say, well, these are the well-respected doctors in my state, and they say this is crazy. So do I have to go figure it out on the internet, or is there potentially a way to
exactly what we did.
bridge that gap?
What we did, the internet. If it wasn't for the internet.
And the issue with credentialing is credentialing is really local. I mean, it's really done within your own institution and by your own peers within your institution decides whether somebody is credentialed to do something, surgery or whatever it is. There is, at the meetings that we've had at the regional therapies meeting that's sponsored by the University of Pittsburgh that we go to, and at the biannual meeting that most of us attend, there's always this talk about standardizing it, even in amongst ourselves. You know, Dr. Sardi in his lecture mentioned that there's a lot of variables. People use different amounts of time, different types of chemotherapy, different heat, different, surgical approaches to things. And within the community itself, which at this point is still relatively small, those of us who do it as their primary clinical practice are interested in trying to standardize and see if we can agree on some of these things, open versus closed. I mean, these are still all issues that we're resolving amongst ourselves as well. So we do talk about it, and we recognize the need for the standardization and quality assurance, because like Dr. Sardi said, we have, if at some of the surgical oncology meetings, you start to see people who are developing programs and putting together posters about their first 20 patients, and as you say, there's a learning curve that can be a little scary, that can make it look like it's not as good as and effective as it can be, and so it's hard because you want to have some control over that, but there's really no board or mechanism for doing that just yet, so we try to do it amongst ourselves in these meetings that we have dedicated to this effort.
One thing that is happening, if you look at the programs of the Society of Surgical Oncology, American College of Surgeons, you are now seeing a lot more publications and a lot more reviews and acceptance on this therapy. And I think we are moving forward, but we are far from there. I mean,
and I don't get as many cases of this being experimental as I did 5 years ago. So.
And it's even very controversial among surgeons. I mean, I have, we are general surgeons before we are cancer surgeons, and when I moved from an institution when I was finishing my surgical training, from open and closed patients to going to an institution that we were doing this a day later. That were very aggressive operations to remove tumors. So there's a lot of training and acceptance that needs to occur, but I think we're moving forward on those lines.